Let's discuss about management of diabetes in pregnancy. And in this we'll discuss about the first line management, second line management, the fetus surveillance, and also we'll discuss the mode of delivery that we prefer in pregnancy in diabetes. Okay, the first thing is, as I told you, we have mainly two lines of management. First line is diet and exercise. This is the first line of management that we have. And the second is we'll infuse insulin. We'll ask the patient to take insulin. So the first, and we'll prefer second line of management only when the first line of management fails. Okay, so let's see what we do in diet and exercise. First, we'll ask the patient to take diet and do 30 minutes of exercise. 30 minutes of exercise. The diet should contain 20% of proteins, 40% of carbohydrates, and 40% of fats. 40% of fats. And the daily requirements of calories depends upon BMI of the women. Based on BMI, will decide the amount of calories that women has to take. If the BMI is less than 25, then the amount of calories that women has to take is 3000 kilocalories per day. Okay, if the BMI is less than 25 kilograms per meter square, then the required calories are 3000 kilocalories per day. If the BMI is between 25 to 30, then the required calories are 2500 kilocalories per day. If the BMI is greater than 35, then the number of calories that has to be taken is 1500 to 1250 kilocalories. 1250 calories to 1550 calories per day. So these are the required calories that women has to take based on her BMI, right? So what we are doing? What is our final target? Our final target is to decrease glucose levels. To decrease glucose levels in the body. So the target glucose levels are pre-meal glucose levels should be less than 25 milligrams per dl. Post meal after 1 hour is 120 milligrams per dl. Post meal after 2 hours. Our target is 140 milligrams per dl, and HbA1c level should be less than 6%. This is our target glucose levels. For this, we will recommend the diet and also exercise, right? So when all this diet and exercise fails, then we'll ask the patient to take insulin. And you see, when do we say it has failed? When do we say diet and exercise has been failed? We say diet and exercise has failed if we cannot achieve these results. Within 2 weeks. If we cannot achieve these results within 2 weeks, then we say the first line therapy has been failed, and we'll prefer second line therapy, which is administration of insulin. Here, one thing we have to remember is all oral oral anti-glucose or oral hypoglycemic drugs are contraindicated. All oral hypoglycemic drugs are contraindicated except metformin and glyburate. Except metformin and glyburate. Okay, in diabetes in pregnancy, all the oral hypoglycemic drugs are contraindicated except metformin and glyburate, right? So now we are infusing insulin, right? The insulin isn't that we use area or short and intermediate acting insulins. Okay, short and intermediate acting insulins are used if the dose is 0.7 to 1 international units per kg per day, right? So this is the required dose when you take insulin in pregnancy. This is about second line therapy. Then moving to fetal surveillance. Fetal surveillance, right? Here fetal surveillance will start at 28 weeks. Okay, we will start doing fetal surveillance 28 weeks if the fetus is intrauterine growth restricted. Okay, the fetus is intrauterine growth restricted, will start fetal surveillance at 28 weeks. If the patient is stable and the fetus is also safe, then we'll start fetal surveillance at 22 to 34 weeks. In case of over diabetes and those gestational diabetes patients who are taking insulin, okay, in over diabetes patients and those women taking insulin, in these patients what we do is we will admit the women at 34 weeks of gestation and we'll do antepartum monitoring 3 weeks a week, and we'll admit the patient at 34 weeks and we'll do antepartum monitoring thrice a week, right? So, and we'll ask the women to count the kicks, to count the fetal kicks, right? So this will give us an idea how healthy the fetus is in the womb, right? So this is about fetal surveillance. In fetal surveillance, what we discussed is, in a stable and safe pregnancy, we'll start fetal surveillance at 32 to 34 weeks. In case of intrauterine growth restriction, we'll start fetal surveillance at 28 weeks. In case of both diabetes and those gestational diabetic patients who are taking insulin, we'll start admitting the patient at 34 weeks and we'll do antepartum monitoring thrice a week, right? This is about fetal surveillance. Then move to obstetric management. So here the management depends on the women and the glucose levels, whether they are controlled or not. Gestational diabetes controlled by diet. If the gestational diabetes is controlled by diet, then the time of delivery is at the 39 weeks or greater than 39 weeks to 40 weeks plus 6 days. So if the levels are controlled, then the time of delivery is 39 weeks or to 40 weeks plus 6 days. So this is the time duration during which we do delivery in case of controlled diabetes. If gestational diabetes controlled by insulin, then the time during which we do delivery is 39 weeks to 39 weeks plus 6 days, right? So during this time we'll do delivery. In case of over diabetes, we do delivery between 37 weeks to 37 weeks plus 6 days, right? So this is the time during which we do delivery. Here induction of labor is safe in of diabetic female. Induction is safe, and the preferred mode of delivery is vaginal delivery. And after delivery we have to follow up the patient. Because 50% of the patient 50% of the women who have developed diabetes during pregnancy will develop permanent diabetes in the future. So we want to know whether the patient whether the woman is going to develop diabetes or not. For this we will follow the patient, right? So for this what we do is, we do 75 gram oral glucose tolerance test. We'll do 75 gram oral glucose tolerance test. We'll do this test we'll do this 4 to 12 weeks of puberty, right? After delivery we'll do 75 gram oral glucose tolerance test between 4 to 12 weeks, and then after we will do the same test every 3 years. Okay, so after the delivery we will do 75 gram oral glucose tolerance test between 4 to 12 weeks. Then after we will do the test for every 3 years.